So the first one we're going to do for the elbow is going to be the varus valgus. So for valgus, it's going to be pushing medially, and then varus is going to be feeling that movement laterally. Just assessing how that joint is moving and feeling for the stability within that joint. So for this test, we're going to be doing Cosen's, and it's testing for lateral epicondylitis. So what you're going to have the patient do is you're going to have them make a fist. You're going to have them pronate their hand. They're going to radial deviate. They're going to extend. And then you're going to palpate on that lateral epicondyle, and you're going to push and have them resist you. And you're feeling for if there's any pain in that lateral epicondyle with that. The next test for lateral epicondylitis is going to be Mills test. So what you're going to do is you're going to grab onto that lateral epicondyle. You're going to palpate it, and then you're going to pronate their arm and flex it up. And then you're going to extend that elbow and then bring it back. And you're going to see if there's any pain. You can do a little ulnar deviation with that. If there's any pain with that, that could indicate a lateral epicondylitis. The next one for lateral epicondylitis is going to be Kaplan's test. So what you're going to have them do is it's a grip strength test. So you're going to have them hold their arm straight out, and they're going to do a grip on the dynamometer if you have one. And then you're going to place your hand over that lateral epicondyle, but just distal to there, over those extensors, and you're going to hold it, and they're going to do the same thing, and you're going to ask if there's more pain or less pain. If there's less pain, that could indicate that there's a lateral epicondylitis. So the next test is a chair or a book lift test. Basically all you're doing is you're testing for that lateral epicondylitis still. So what they're going to do is they're going to extend their arm out, and then you're going to have them pick up something and then hold it out. That is testing to see if there is pain in that lateral epicondyle. If there is, that could be indicative of a lateral epicondylitis. So the next one we're going to do is going to be the reverse Cosen's, and that's testing for medial epicondylitis, or the golfer's elbow test. So what you're going to have the patient do is you're going to have them supinate their hand, and you're going to have them extend the wrist, and you're going to have them try to flex the wrist and flex the forearm against your resistance while palpating that medial epicondyle. If there's pain on that, that could indicate there's a medial epicondylitis. So for Tinel's sign, all you're going to do is you're going to, in the elbow, what you're doing is you're tapping on that ulnar nerve that's in that cubital tunnel. So all you're doing is you're going on there and you're tapping on there. If that is painful or if there's tingling after that, that is a positive test, because that shouldn't, just a light tap should not induce any pain on that. So the first one on the wrist is going to be the varus valgus. So for valgus, all you're doing is you're pushing from lateral to medial with that palm up, and then varus is pushing medial to lateral, just feeling for that stability within the joint and see if there is any ligament instability. So for the scaphoid shift test, or for the Watson's test, you're going to have the patient normally sitting on a table across from you, but what you're going to do is you're going to ulnar deviate their hand, and you're going to extend it, and then you're going to take your hand on the scaphoid and you're going to press down with the thumb, and then you're going to bring them into flexion and radial deviation. And when you do that, if there is a thunk or a click or anything in there, that means that there's instability within that scaphoid, and it's a positive scaphoid shift test or Watson's test. So this next test is going to be the ulno meniscotriquetral test, or the dorsal glide test. So what you're going to do is you're going to find that distal ulna, ulnar styloid, and you're going to press your thumb on it while putting your pointer finger on the pisi, and you're basically feeling the glide in neutral. Then you can radial deviate, and then feel that glide, feel that shear going back and forth between those two, and then you can go to ulnar deviation and do the same thing. So for the Finkelstein test, what you're going to have the patient do is you're going to have them put their thumb inside of their palm, and they're going to squeeze, and you're going to stick your hand out, and you're going to ulnar deviate, so push that down. And then when they do that, if there is any pain in there, that is a positive test, and that means that there could be peritendinitis of the abductor pollicis longus and the extensor pollicis brevis tendons. So next we're going to do the carpal compression test, where all you do is you find that carpal tunnel and you're holding pressure on that carpal tunnel for 30 seconds. And you're checking to see if the patient has any numbness or tingling in that in their fingers after doing that test. So the next two we're going to do is going to be phalans and reverse phalans. So for phalans, what you're going to have them do is you're going to have the back of their hands put together and bring them up. You're going to hold that for a minute. If they have any pain or numbness or tingling in their hands, then that could indicate that there's some type of compression on the nerves running to the hands. The other one is going to be reverse phalans, which is or prayer test, and it's the same thing. If there's any numbness or tingling, that means that there's some type of compression in the wrist. The next one we're going to be doing is going to be Tinel sign. So for Tinel sign, all you're doing is you're finding that carpal tunnel, and you're going to be tapping on it. And if there's any type of tingling or numbness that shoots down into the patient's, or pain that shoots down into the patient's hand, that is a positive Tinel sign within the carpal tunnel. So the next one we're going to do is going to be Allen's test. This is the test, so it's in the wrist, not Allen's maneuver. That's in the upper thoracic, for thoracic outlet syndrome. So what you're going to do is you're going to bring the patient's hand above their heart. You're going to cover the radial and ulnar arteries. You're going to have the patient pump their hand 3 times. Okay, and then make a fist. Yep, and then I'm going to bring it down below their heart, and I'm going to release one of the arteries, have them open their hand, and you should see all the blood flow back in. You do the same thing for the other artery. So you're going to pump them 1, 2, 3. Make a fist, bring it down, release for the other one, and watch the blood flow back in. You're checking for blood flow on both the radial and ulnar arteries. So next what we're going to do is going to be Finsterer's sign. And what you're going to do is you're going to find the lunate. So you're going to flex the wrist, you're going to find the lunate, and then all you're doing is tapping on that lunate. If there's any pain or like a dull, achy pain in there, that could indicate avascular necrosis of the lunate, or also known as Kienbach's disease. For the next one, we're going to do the Froment sign. So basically all you're going to do is you're going to have the patient hold onto a piece of paper. You're going to make a fist. I'm going to slide it in there, and you're going to hold onto it with the pad of their finger, and then you're going to pull away. If the patient has to evert to actually using the tip of their finger, then that is a positive Froment sign, and that indicates a paralysis of the adductor pollicis longus muscle.